So good afternoon, everyone, and welcome. My name's Joanne, and I'm a health and safety consultant at Safety Forward. Just to let you know, this session is recorded, and if you have any questions, if you could submit them through the chat function, and we'll discuss them at the end. If there are any questions we're unable to cover or that I'm not quite sure about, a separate response will be forwarded after the meeting as well. Over the next 20 minutes, we'll be delving into the crucial topic of workplace risk assessments. It's important to remember that this isn't just about ticking a box. It's about proactively creating a safe and healthy environment for everyone. So what to cover? We'll cover the what and why, but more importantly, the how. So how to identify hazards, evaluate risks, implement control measures and document findings, as well as going through a simple 5-step process that you can apply in your own workplaces. I'd like you, all of you, if you can, just for a second to have a think about the work you do every day, even just looking around the rooms that you're in. What are some of the things that could go wrong? What are some of the hazards you can see? Risk assessments are put in place to help us identify those things and put measures in place before an accident occurs with them. So what exactly is a risk assessment? The correct wording is a systematic process to identify hazards and evaluate risks. But simply, it's a careful look into what, in your workplace, could cause harm to people. It's about figuring out if you've taken enough precautions or if you need to do more. Risk assessments are required by law. The Health and Safety at Work Act 1974 and the Management of Health and Safety at Work Regulations 1999 require employees in the UK to conduct a risk assessment, even for businesses with less than 5 employees. The difference is if you have less than 5 employees, you don't have to record it. However, even if it is in your head, you do still need to do one. If you have 5 or more employees, you must record it or document it. But let's just not focus on the law. The real value is in protecting people. A good risk assessment allows us to avoid injuries, illnesses, and even fatalities, which benefits everyone, our colleagues, our families, and the business itself. It reduces staff absences, lowers insurance costs, and also improves morale. Okay, so what we're going to do is break down the process into 5 straightforward steps. This isn't a complex theoretical exercise, it's a practical tool, and we'll go through each step in detail. The first step, we'll look into what causes harm, and we'll discuss how to do this effectively. Step 2, we will evaluate the level of risk associated with that hazard and who might be harmed and how. Step 3, we decide on and put in place, which is the important part, the necessary controls that manage the risk. And step 4, we write it all down, especially if we have 5 or more employees. Step 5, and finally, we review the assessment regularly to make sure it's still relevant. Now, what I should have done is put another arrow here on there because this process is a continual process. It doesn't just stop at the review and update. It will keep going around this circle. So number 1, the what if question. This step is all about asking what could go wrong. A hazard isn't the accident itself, it's the potential for an accident. For example, a wet floor or a trailing cable is a hazard. A slip and the fall is the outcome of that hazard. So how do you spot them? So I would recommend walking around your workplace, involve your employees, review accident records, look at a manufacturer's instructions for the particular hazard, if it's a machine, for example, and consider non-routine tasks. Hazards can be classified to make them easier to spot. There are different types of hazards. We have physical hazards, including things like noise, electricity, and fire. Chemical hazards are substances like cleaning fluids or dust. Biological are the things like bacteria or viruses. Ergonomics are related to how we work, such as poor posture. And psychological hazards include things like stress or bullying. So number 2 is to evaluate the risk. A risk is the likelihood that a hazard will cause harm and the severity of that harm. We do the risk versus hazard, which is the key distinction. The hazard, for example, is the wet floor. The risk is the likelihood of someone slipping and the potential injury they might sustain from that. A wet floor in an empty locked room has low risk, whereas a wet floor in a busy walkway where lots of staff are walking past constantly has a high risk. And who is at risk? With this particular part, you do need to be specific. If it's an area, it could just be the staff, it could just be the machine operatives, but you could also think about things like visitors and contractors that come to site as well. Is it just the operator of the machine, or could also be somebody passing by also be affected? Think about vulnerable groups also, like new starters who might not be trained, or people with a disability. We use a simple matrix to help us prioritise. I've put one of the more simpler ones on the slide. There are a lot more complicated ones out there with a bigger matrix, but I've just put this on here just for clarity. So let's take the wet floor, for example. What's the likelihood of someone slipping in a busy office? Probably high or medium. And the potential severity, a simple bruise is a low or even a broken bone. This gives us a risk score. So high likelihood plus medium severity is a high risk priority. This simple tool helps us to decide what to tackle first. If you've got a lot of risks and you evaluate them, you can clearly see which is the more important one to tackle. So the practical application, we don't need to overcomplicate it. Just a simple thought process. How likely is this to happen and how bad could it be? And once we know the risks, we need to do something about them. And this is where we implement the control measures. We use the hierarchy of control, which I have put on the slide for you as our guide. The first one is elimination. This is the best option. Can we stop doing the hazardous task? For example, instead of manually lifting, can we use a lift? That eliminates the risk completely. Substitution. If we can't eliminate it, can we replace it with something safer? Instead of using a chemical with dangerous fumes, can we use a water-based alternative? Engineering controls. Can we physically separate people from a hazard? This includes like machine guards, ventilation systems, or soundproofing. We then have administrative controls, second to the bottom. These are changes to our procedures. This includes providing training, implementing safe work procedures, putting up warning signs, or rotating tasks to reduce exposure. And the last one is PPE. This is the last line of defense. It doesn't control the hazard, it protects the person. Things like gloves, safety boots, or goggles. We should always try to use the higher level in the hierarchy first when we're thinking about elimination, thinking about the hazard and how to control it. Start from the top and work your way down. As PPE can fail, it can be misused or uncomfortable to wear, so people don't tend to want to wear it. The best control of a hazard is to take the human element out of it. That's just to stop mistakes from happening. So let's revisit the wet floor. What are some controls that we could implement? We could put up a sign, which is administrative, but a better solution would be to dry the floor. We can't eliminate the need to clean, but we can eliminate the wet floor itself. Okay, documenting your findings. Why do we document risk assessments? Documentation is vital. Firstly, it's a legal requirement. And secondly, it serves as a record for your actions. If an accident happens, you can show that you took reasonable steps to manage the risk, and it also allows for consistency and for others to understand the risks and the controls. You don't need a huge complex document, a simple form or a template will do. Just make sure it clearly lists the hazards, the risks, the controls, and the date for the review. Think about the audience. Remember, this document might be read by a new employee or an inspector. So it does need to be clear and easy to understand. Once you've written the risk assessment and thought about the controls, remember it doesn't stop there. The controls you have thought about do need to be implemented. And as I mentioned before, that is quite an important part of it. Okay. If you've completed the above 4 steps, you'll have something that kind of looks like what I've put on the screen. This is one of our templates that I've just adapted for what we've been talking about today. So you'll notice we've got the title of the risk assessment, which I've put as slips, trips and falls. Activity assessed, I've put making a cup of tea. Activity location, this particular one is for the kitchen. You put who it's assessed by, and always put a recommended review date. This review date can be annually, but if the risks are more severe or things are likely to change, or if you want to make sure things are implemented, I would recommend reducing that review date to potentially 3 or 6 months, depending on the times you've got for the actions to be implemented. I've also included the likelihood and severity table, the risk table, the explanation for that, who's at risk. So we've got the staff, contractors, visitors, and we've got the hazard itself, which is the wet floor. Injuries from slips, trips and falls is the potential harm that's caused. In this particular section as well, I would put in there the actual injuries that would be caused. For example, bruising, broken bones, that type of thing. And the current controls that we've got in place. So the current controls for this particular place would be spilled liquids cleaned up immediately and warning notices put out when the floor cleaning is in operation. This will reduce the risk to an acceptable risk. If these weren't in place, it would be a more moderate to high risk for this. And if there is any other controls that you could think of, this is where you would put it. You would put who you would assign it to. I would always allocate actions to a person and not a department. That way there's a bit more autonomy on who would complete those. The date for these to be actioned by, and the completion date of when everything needs to be completed. So this is a basic overview of what the risk assessment would look like. You can add further hazards for each department, like the kitchen could have lots of different hazards, like the fire and the cooker, and all of that can go in there as well. Okay. The last step is to review and update your risk assessments. This step is crucial. Risk assessments are not a one-off task and need reviewing regularly. They, at a minimum, need reviewing annually if the risks are well controlled and unchanged, but they will also need reviewing if there are significant changes to a workplace. An accident or a near miss occurs, vulnerable workers are now involved, or if there are new legal updates. A workplace is constantly changing, new equipment arrives, new processes are introduced, and we learn from the incidents. Our risk assessments must evolve with these changes. Risk assessments need to be a proactive approach. A review doesn't have to be a major event. It can be a quick check to see if all the control measures are implemented in the dates that are noted on the risk assessment, or if anything has changed, and if the controls are actually working. If you buy a new piece of machinery, a new risk assessment should also be completed for it. If an accident or a near miss occurs, the first thing we should do is review the risk assessment. Was the risk missed? Were the controls ineffective? Things like this help us learn and prevent a similar incident from happening again. So to wrap it up, a risk assessment is a straightforward, logical process. It's about being proactive, not reactive. By identifying hazards, evaluating risks, implementing controls, documenting and reviewing, we create a safer, healthier and more proactive workplace. I encourage you all to take this information back to your teams. Start small. You don't need to do everything all at once. Identify one hazard in your area and think about how you can control it. This is the first step to creating a culture of safety where everyone looks out for one another. And remember, you can always reach out to your Safety Forward consultant if you need any help with your risk assessments. We do hold a stock of them to cover more frequent hazardous tasks, but we are happy to work with you as well to develop further assessments for more niche assessments or some that we may not have thought about. You can also find information on the HSE website, and there is also a template on there as well to help you. And if you're really struggling or unsure about any activity or piece of equipment and what hazards they present, tools like ChatGTP or other AI functions can also be a valuable tool. Brilliant. Well, thank you everyone for joining me today. And if you do have any questions, please feel free to call or email Safety Forward and we'll be happy to help. Thank you. Bye.